ora, my name is Mama Kukendale. I'm from Ruatoki. I've got nephrotic syndrome, so I'm an end-stage renal failure patient. I've been dialysing on haemodialysis in the Whakatane renal unit for nearly 5 years.
Yeah, morning, my name is Joe Hokianga. I've been a renal patient for 2 or 3 years now. I dialyse Tuesday, Thursday and Saturday, 3 days a week.
And since I've been dialysing at the hospital, we've had to, all of the renal patients have had to travel across to Waikato and Hamilton, and also the physicians come down either every 3 months or every 6 months, and we get allocated a slot.
For our patients down in Whakatane, it's quite isolated, and to get over to Waikato, it's about 2.5 hours drive one way. So in a day, that could be up to 5 hours for a patient who's already not well with renal failure to travel. So it's quite a long distance to get access to doctors sometimes, or to renal doctors anyway. So what we tried to do was to ease that burden for the patients by setting up the Telehealth clinic. We could see a real benefit for the patients with less travel time, less disruption to their lives, and just easier for the patients to meet with the renal specialist.
The physician, myself, would be based in Waikato Hospital, and once a month remotely video linking with the satellite unit. On the other end, there would be a nurse and a whole list of patients to be seen. The video consultation is done in exactly the same manner as a normal clinic, except that the nurse would do the patient observations such as the blood pressure and weight management, and also the medications reconciliation. The nurse would also fill out the blood forms, and any prescription changes would be faxed across or scanned across immediately.
The alternative to the telehealth would be that the patient would have to wait until the next clinic appointment, which might be in a month's time, and that's a long time when you're talking about cases like this, when you need decisions, you need immediate decisions really. So that's the real benefit of the telehealth. Often I can just call up the consultant, say to him, look, I've got this problem, or the family would like to meet with you, the family would like to discuss, the patient would like to discuss something, and we can set up these impromptu meetings outside of the telehealth clinic.
The screen comes up and the physician from Waikato or Tauranga will be on the other side and would have all our notes accessible, and then would talk to us about any concerns, and we get the chance to talk to him about any concerns we have.
I mean, it's the same as talking to the doctor here. We're face to face. That's more or less the same to me. He knows my situations. He's telling me what's wrong with me, and I go along with everything he says, which is true.
The travel time for me is just, it's awesome, because in my case I have people that have to take time off work, and the travel cuts down everything, money wise. We can have more time to spend with the doctors, because if we have any questions, we can just go into the room and then they can talk to us over the screen, rather than wait another 3 months or wait another 6 months before we can see him.
We can talk to them straight away if we need to. I mean, he can't come tomorrow if we need him, but we were able to get on there and talk to him, sort of thing.
I'm a Skype user anyway, so it was good for me, because well, I'm a bit younger, so I'm used to the environment.
all the patients seem quite happy with the clinic. A lot of them like the ease of being able to speak to the doctor, particularly the dialysis patients. They like being able to finish the dialysis session, come straight out into the room, have the clinic appointment with the doctor and then go home again and on with the day. So it's less disruption to their lives really. So that's a real positive for the clinic.
They really like the setup of the virtual clinic appointment. For the staff, particularly the nurses, it meant that they have more regular contact with the physicians. And for the patients, it meant that they didn't have to wait for a full month before they got seen. I used the virtual setup not only to see patients in the virtual clinics, but also to do other things such as virtual clinical assessments. For example, they could have problems with their fistula or the access or an infection, in which case all I need to do is bring them in front of the camera and I could solve a lot of the problems just by using the virtual link, and therefore reducing the need for admission or transfer to the main hospital.
Yeah, I quite like that actually. When I first went on there, I thought, oh, didn't think much, but as I got to know it, I love it.